Hi there, I'm Dr. William Plow. The purpose of this video is to assist you in the collection of your stool sample for the Genova Diagnostics Comprehensive Digestive Stool Analysis, or CDSA test. So, let's see what we have here. This is the test kit. This is the requisition form. This is the order to the lab that has all the information they need. This needs to go in the kit when you mail it to the lab. Okay? So the doctor will sign it, will fill in the appropriate diagnosis codes and the appropriate billing information. You usually will be paying the lab either the full fee for the test or a preferred pay amount, so the amount enclosed should be included there too. The test we order here will be the CDSA, and then here's an important piece. When you do the actual sample collection, make sure you fill in the date that you collected the sample right here. Okay? Now let's look at the back of this. This is where all of your demographics information goes. Okay? Medicare information, if appropriate, would generally need to go through a medical doctor or osteopath, because it won't be a Medicare covered service if ordered by a chiropractor. This is where you put your payment information, so your credit card information, or you can enclose a check if you'd prefer, and then you need to print and sign and date on the bottom of the requisition form here. Okay? So there's the requisition form. Now let's see what's in the kit. So the first thing I want to bring to your attention is a patient questionnaire. Now this is really a research tool. Okay? So I'd like you to go ahead and fill out the questionnaire and include it with your sample when you send it to the lab. The lab uses this information to correlate symptoms with findings on the tests to better understand the nature of GI function, the utility of these tests in evaluating GI complaints. It is optional to include your contact information. If you choose, you can include your contact information, and the lab will follow up with you after 3 months or so and maybe have you do another questionnaire so they can, again, correlate your symptoms and any changes in your symptoms with the results on the tests. So this is a research tool. Please do fill it out and include it, and then it's up to you whether or not you want to include your contact information. The next thing we see here is the kit instructions, and it starts with a list of everything that's inside the box. So you've got the box, and then you've got the collection tubes. There is a yellow top tube and a orange top tube. You have a white top cup as well. And then we have the collection tray and a vinyl glove and a wooden spatula to assist you in collecting your sample. Here we also have the biohazard bag. So once the sample of stool is collected in the containers, they will go in the biohazard bag with the white absorbent cloth, and then the bag will go in the box, and the box will go inside the FedEx mailer, and then FedEx will come pick it up and take it to the lab. Okay? So double check your kit and make sure it has everything in it. Okay? The next page goes into patient preparation, and there's some really important details here. First of all, you have to be really careful when you're opening the tubes and making your sample collection. If you spill any of the fluid from the tube, that will invalidate the test. So what you need to do then, if that happens, is contact the lab and let them know, and they'll send you a replacement tube. Okay? The other thing to be aware of is there are supplements and medications that will interfere with the results of these tests. So there's a list here of medications and supplements that you need to discontinue. I'm recommending 3 days at least before the test. You need to discontinue any bentonite clay if you're taking that. Betaine hydrochloride or hydrochloric acid supplement, you need to discontinue that. Any digestive enzymes to help you with digestion, you need to discontinue those. Any castor oil, mineral oil, or rectal suppositories, all these products need to be discontinued for at least 3 days before the sample collection. Furthermore, if you have any acute gastrointestinal illness, if you've had food poisoning, or if you've had a viral, quote, stomach flu recently, you really should wait about 4 weeks before doing your sample. Or if you've had a colonoscopy or a barium enema, you need to wait at least 4 weeks before collecting your sample. Furthermore, if you are taking antibiotics or antifungals, or, and this is important, if you're taking any beneficial floral supplements, any probiotics, any of the probiotics you get here or from another source, you need to discontinue those products for at least 2 weeks before the test. Okay? And that includes probiotic foods such as yogurt, kefir, kombucha, sauerkraut, any foods that have good bugs in them, or any supplements that have good bugs for the gut. You need to discontinue those for 2 full weeks before the sample collection. We really want to get a picture of what's the population of the good bugs in your gut as they are naturally without those supplements. Okay? Other than that, you want to eat your normal diet. Okay? So, prepare for stool collection. You want to plan for a Monday through Friday collection. So figure out what day is going to work best for you. Okay? And plan on shipping on Monday through Friday. Now let's walk through the steps here. First of all, you need to write your name and the date and time of collection on each of the tubes. So let's take a look at the tubes here. Each of the tubes has a little section where you can put your name and the date. You want to also include the time. Okay? And also the white top cup has a place for name, date, and time. In addition to putting the date of collection on the requisition here, you want to make sure that it is also on each of the tubes here. Okay? Now when you get ready to actually collect the sample, you want to make sure that you don't contaminate the sample with any urine or with any water from the toilet. So you have to kind of pretend you're camping and use your little collection cup and collect the stool in the cup without any contamination. Okay? Then you open the tube and you'll notice the underside of the cap has a little spoon attached to it. So you take the spoon like it shows in the picture here, and you'll take a sample of the stool from different areas. If you see contrasting appearances within the collection container, you want to take a sample from the different areas and put it in the cup. You have the spatula to assist you if you need, and you only want to fill it to the horizontal line. So look closely, it says add specimen to this line, so it's not a whole lot, only about that much. Okay? You'll do the same thing with the orange top container. It's got a little spoon on it. You fill it up to the red line. Don't overfill the tubes. Okay, the amount of chemicals that are in the tubes are calibrated to the volume of stool sample that you're going to be putting in there. So make sure you only add it to the fill line. And then go ahead and include some in the stool collection cup. Fill it up to about the 40 milliliter line, which is about even with the patient name line here. Once you've collected the stool into the tube, you want to kind of mix and mash it up with the fluid, cap it really tightly, securely, and then shake it really good for about 30 seconds so it's very mixed up. Okay? So the instructions here take you step by step through all that. You've got all those filled, and then you want to move on to the shipping instructions. So once the tubes are all filled, you obviously discard the stool and the spatula and the glove. Then the tubes are going to go into the biohazard bag. Make sure they're securely capped. Put them in the biohazard bag and seal it. Okay, make sure that the little white absorbent cloth is in there as well. Then you take your requisition form, make sure that it's completed and that the payment is completed, or if a check is enclosed. And ideally you want that to go in the little outside slot of the biohazard bag as well. Okay? You also want to make sure you include your completed patient questionnaire. You can put that in the same slot, or you can just put it in the box. The bag goes in the box, and you close the box. And then the box goes inside the FedEx mailer here. The billable stamp is included already. This is your copy for tracking. Okay, you can put your return address here. You don't need to sign the release signature. That's for the people receiving it to sign. Okay, but the box goes in to the FedEx mailer, you peel it, you seal it, and then you call FedEx and you request a pickup. You want to tell them this is a medical specimen, it's an overnight delivery, I have a billable stamp, and they will send a driver to pick it up. If you have any questions or concerns, then just give us a call. Thanks.